The Section 59 investigation report has just been released by Advocate Newzroom. Joining us is Dr. Donald Gumede. He is the chairperson at the National Healthcare Professionals Association. Dr. Gumede, just before the break, I was asking you to make it practical for us. The type of processes that would go through in evaluating submissions from a black medical practitioner vis-a-vis those from a white medical practitioner. If you could just practicalize that for us.
Yeah, let's first say this, the medical aids in particular, they send people that they call probes. So those people are actually not patients. They are people who fake illness. And then they will come to your practice and then say, doctor, I have a headache, or I've got diarrhea, or some of those ailments, which sometimes, they are very difficult to prove, because, it's very difficult to prove that someone has got diarrhea. It's a hearsay. And then those people, they will consult with you, and maybe they will say, I can't go to work because I'm weak. And then maybe you write a sick note. I'm just painting different scenarios here for actually GPs. And then those guys, they're not patients, like I said. They will collect your sick note and collect your medication that you have given them and hand it over to the medical aids, whoever medical aids send them to you. And after they've done that, then they will call you to their offices, these guys, and say, you consulted with patient X, you wrote a sick note. And this is not a joke. There are doctors who actually have been summoned because they apparently wrote sick notes for the patients who alleged that they were sick, and according to them, they were not sick. And then they will say to them, okay, because of this, like advocate was saying, we need $500,000 from you. And if you don't give us that $500,000, we're gonna report you to the council so that you get struck off the roll. And this is sad because you see now your profession is threatened. Majority of the healthcare professionals will cave in and sign those acknowledgement of debts, which actually that's how these medical aids make money out of the practitioners. So they're gonna compound it and say, for the past 3 years, we believe this is what we have been doing, giving people sick notes. So we need $500,000 or we need $2 million. We have got practitioners who actually were fined up to 11 million or 10 million. And it's a fact. It's contained.
So let me get this clear, Dr. Gumede. These amounts that would then be requested or asked from you as medical practitioners from the medical aid schemes, what are they supposed to signify and symbolize? Are they an admission of guilt, or are they really just daylight robbery, you being pickpocketed?
Yeah, that's why, remember, we stood up and say, if I'm fraudulent, report me to the police. Let the police deal with the issue. Why do you extort me? Why do you extort money from me? So to me, it's extortion. Because you see, like the report indicates, these amounts are thumbs-up. They are not scientifically proven. They are not actually, there's no actuaries who actually prove, there's no formula. So it's arbitrary amount. They look at you and says, okay, we think you qualify to pay us 1 million, or you qualify to pay us $500,000. Which is sad, because you see, and I alluded to these issues to say, these guys that become the police officers, the prosecutors, the judges, and the prison wardens. So it was one system running the whole show, and that can't be right. There will be no element of natural justice if that situation was allowed to continue. And, it's a money-making scheme. Let me put it clear. Because, you see, if it was about fraud, these guys, they would have actually established a fraud a tribunal, or so to say, to curb the fraud. We're not saying there are no practitioners who do funny things. There are, and it's a fact. And that's why the commission also find out that actually the Health Council must play ball as well. Because we want to curb the fraud, but we do not want to be extorted. Let those who commit fraud be brought to book. But it cannot be right that because of the color of my skin, then I'm labeled fraudulent. That can't be right.
And I want to pick up on that, Dr. Gumede. What have been the experiences of your white counterparts?
I mean, there are very few of them. Remember, Mango, what is said, the statistics that I'm going to give you. Our white counterparts, doctors or healthcare practitioners, if you didn't know, even in this population that we are the majority as blacks, there are more than us as doctors. So there are more white doctors than black doctors in South Africa. We are around, I think, 38% as blacks, but we are the ones who are mostly victimized. We are the ones who are extorted. We are the ones who are abused. And I mean, the majority of them, some of them, you talk to them, they say, what are you talking about? We don't know. We're not saying some of them are not targeted, but there are few cases that I know of them being targeted. But like I'm saying, the majority, it's us. You know, you cannot go to any black practitioners and ask them, have you ever had any problem with medical aid? And they say no. The likelihood they've received letters, threats, and everything. So our white counterparts, no, majority of them, they don't know what we're talking about.
Well, let's continue and look at other aspects of this report. The report has further found that MedScheme was leading in terms of targeting black medical practitioners who have committed fraud. Let's take a look. Let's take a look at this bite.
That collectively, the schemes are likely to discriminate against blacks on the basis of race. We also find that individually, the scale of racial discrimination differs. So in other words, it's not a blanket case. Even when it is individuated, there is a difference. What do we mean by that? One, for discovery, we find that there were 35% more likely to identify black providers as having committed fraud, waste, and abuse. And this is the lowest rate of the three schemes and administrators we looked at. Its discovery has the lowest rate of the likelihood of unfair racial discrimination. Number two, GEMS is 80% more likely to identify black providers as having committed fraud, waste, and abuse. MedScheme, which has the highest likelihood, is 330% more likely to identify black providers as having committed fraud, waste, and abuse. So to emphasize the point, we find the schemes collectively are likely to identify blacks as having committed fraud, wastage, and abuse. But we also find that individually, discovery is 35% more likely to do the same, GEMS 80% more likely to do it, and MedScheme 330% more likely to identify black healthcare providers as guilty of fraud, wastage, and abuse.
Dr. Gumede, these numbers are just shocking. And what the advocate has said there is that, yes, it is likely to be found across the board, but these three particular agents are literally the ones that are most likely to identify fraud or abuse and wastage. What are the implications of this for your profession?
You know what is said, to be honest with you. The reason why MedScheme is leading is because they have made it a profit situation. If you go through the report, you'll come to understand what I'm talking about. They've got a unit called Afrocentric, which is dealing with what we're talking about now. They incentivize people or their investigators to go and find victims, if I were to put it that way, so that they can get whether it's commission or whatever, kickbacks, whatever you want to call it. So the problem is this thing has become a money-making scheme. It's no more about the real problem. It has become a really money-making scheme, and this has killed the livelihood of many black professionals. You go around and check any black professionals financially, they are in the low. Because of why? Medical aid. Why? Because on the other side, people are busy paying this acknowledgement of debts back to the medical aid just for them to be paid by the medical aid. So it's like you are bribing them to pay you. That's very bad. That's very terrible. I gave the service. Just pay me for the service. Why should I pay you for you to pay me? And all these people that pay them, they don't blacklist them. They don't call them fraudster. It doesn't make sense. You are only called a fraudster if you refuse to pay them.
So, Dr.
So the
Gumede,
likelihood of yeah.
So, Dr. Gumede, what is the way forward now for black health professionals? If you're alleging that indeed you are being extorted, that this is some sort of a bribery by the medical aid schemes, are you going to be taking this further from a legal route? Because collectively, it sounds like, as you say, based on what you're saying, that you actually do have a point here, that you can actually lay, whether it's a class action lawsuit or any sort of legal process that will then ensue from what you have called this racial discrimination, including extortion and.
Exactly. Because remember, when we laid these charges, we also went to the Human Rights Commission. Like what Advocate Tembela said correctly. We went there and laid a complaint with the Human Rights Commission as well, and then they're waiting for the report. The journey doesn't stop here. We need retribution because, I mean, really, many people have lost their lives. I was talking to one member of our association. I'm going to mention him live, Dr. Makumi-san. He was saying, he called me this morning, he says, Dr. Gumede, thank you for supporting me throughout my hard time. I was so depressed. And if it wasn't because of her support, maybe I would have killed myself. So I'm trying to say to you, many practitioners went through hard time, went through or they're still going, and others had to close or leave private practice. Why? Because of these medical aids. There's a doctor who even went into kickboxing or boxing in Durban, because why? The medical aids were not paying him just to make a living to support his family. So this has got a dire consequences. Let's not stop there. We had a case in KZN of a patient who died, who needed dialysis, because why? Medical aid and exclusivity was discovered, which excluded the patient to say, you cannot be dialyzed by this a dialysis specialist because they're blacklisted. In a rural areas, in Nongoma, I mean, there's no other alternative dialysis center. That was the only person who was dialyzing the patient. So the point I'm trying to say is, this doesn't only affect healthcare professionals, it also affects the patient or you guys as a whole. What you don't know, if I were to share with you, the people who make the huge or the highest profit is the administrators. So these guys, that your med scheme is not a medical aid, it's an administrator. They make huge profit at the expense of the health system in the private sector. Now, the sad part, which actually saddens me up to this point, is that, and I'm gonna be blunt with it, our government, it's sitting there. We're talking about racism here. Instead of standing up and saying, hang on, let's address this issue. No, they're not interested. They let us fight these battles until where we are. I mean, really, it pains me.
Have you approached them? Have you approached them? Have you approached them, Dr. Gumede? Have you gone to the doors of government and said, Minister Mkhize, here is a situation that we as black medical practitioners are dealing with? And if you have done so, what has been his response?
Remember last week let's say 3 weeks ago, I was interviewed by ENCA and I explained these issues to say, because they were refusing to release the report. The report was, you guys were supposed to have received the report on the 16th of December. Maybe you don't know that. And the minister says, no, he still wanted to see the report. And hence, then thereafter, I had that interview to say, this is wrong. The minister was supposed to have been given the report last year in April, which is true. We had booked as a steering committee and the members of the associations to go and read the report to the minister in April last year. So, and then it was blocked. And hence, I said in that interview to say, the person who has got the power and the authority to make sure that the report is released is the minister. because he's the custodian of the health matters in South Africa. And okay, then they released it last week to us as a steering committee, which was welcome. But like I'm saying, the minister is well aware of the issues, and he has the report himself. And if anyway we have to believe that he didn't read the report in December, I guess he has read the report. That's why he has authorized that it should be released. So it's known, they know.
I'd like to go back to a point that you made a little bit earlier on, Dr. Gumede, about one of the doctors who was basically blacklisted, whose dialysis patient passed away. Which is the medical aid scheme that did not allow him to basically treat the patient?
It was Discover Health.
And what has happened since then?
We left it with the family because the family had said that they're gonna take actions. I don't know whether they got settlements and whatever, but that we can provide you guys with the information. You can investigate further and see what actually was the outcome of that case, because they wanted to take it legally through the court systems.
And can you remember what year this was?
I think it was 2019, yeah.
Around 2019.
It was 2019, 100%. Yeah,
right.
Even if we were to Google it, the news is there. It should be there.
All right, we'll be in touch with you, Dr. Gumede, and just really follow up on that one particular personal journey that a family had to go through because of some of the complexities that exist between administrators, medical aid schemes, as well as black medical professionals. But just before I let you go, what has been the response of the medical aid schemes so far? What have they had to say for themselves?
But you see, if I were to say this again, these guys are refusing and denying our allegations, so to say. They rebutted them very badly and sarcastically. But you see, now that the evidence has shown that what we have been alleging is true, and coupled with what the chairperson has said, who advocates, they should humble themselves to say, okay, hang on, let's try and correct what we did. I mean, not being arrogant, because what James has done, to be honest with you, was pure arrogance, because the interim report, majority of it contains what they submitted themselves to the commission. There's nothing new or deviating that is not there in the interim report. So instead of accepting that they were wrong, or maybe let's say, guys, let's sit down as a healthcare system and address this issue so that our patients get the best treatment ever. No, they took the hardline route to say, no, we're not guilty, but the statistics and the investigation show otherwise. But they still deny.
Dr. Gumede, we're going to have to let you go. Unfortunately, time is not on our side. But just a verification on your side. You say that this is just the beginning. There's still going to be a long legal process that's going to pursue after this.
Yeah.
All right. Well, thank you very much for your time. Thank you so much for letting us into the picture, Dr. Donald Gumede, there speaking on the release of the Section 59 investigation that was released not too long ago.